This is the Tom Bigby Tales, and I'm your host, Shannon Evans. I write about a small town in northeast Mississippi on the Tom Bigby River called Columbus. Sometimes I write about the rest of the state. This episode is about Elizabeth Lee Hazen, who was a graduate of what is today Mississippi University for Women. At the time of her attending, it was called II&C. Nystatin is a miracle drug to treat and prevent often painful fungal and yeast infections of the mouth and lining of the stomach and intestines and other soft tissues in the body. There's also a powder form that can be used for fungal infections that is used topically. It has a non-medical use as well to preserve trees that are infected with fungi, and also it's used in art restoration on paintings and artwork damaged by mold. Now, who created this powerful antifungal agent called nystatin? Believe it or not, it was two women, biochemist Rachel Fuller Brown and my biologist Elizabeth Lee Hazen. Brown was a chemist who attended Mount Holyoke College, earning a BA in chemistry and history, and then she earned an MS in organic chemistry at the University of Chicago, then attended Harvard before returning to the University of Chicago to do more graduate work before going to work at the Division of Laboratories and Research in New York. 7 years later, she returned to Chicago to earn her PhD. She then went to work for the New York State Department of Public Health in Albany, New York, in a laboratory. It was here she would be introduced to Dr. Elizabeth Hazen, a microbiologist, via the mail. The two would be Hazen would be working in a New York City lab in the bacterial diagnosis laboratory division. Hazen was born in August 1885 in Rich, Mississippi, which is a small, tiny town deep in the Mississippi Delta. Hazen was orphaned as a toddler and moved between family members before being adopted by her uncle and his family, where she would attend a one-room rural school before entering the Industrial Institute and College, the II&C, which was completely across the state in Columbus, Mississippi, where she would graduate with a Bachelor of Science in 1910. After graduation, she taught physics and biology in Jackson, Mississippi, and in summers, she attended the University of Tennessee and later the University of Virginia. She then moved to New York City to attend Columbia University, completing a master's in biology, despite the school having reservations about someone with such a small college Southern background. She then enrolled in a study of medical bacteriology at Columbia College, at the College of Physicians and Surgeons, but she had to cut her time short there to serve in an Army diagnostic lab during World War I, first in Alabama and then back in New York. When the war ended, she became the assistant director of the clinical lab for a West Virginia hospital. This was virtually unheard of for a woman to do in that era. In 1923, Hazen returned to the College of Physicians and Surgeons and completed her doctorate in microbiology. She then went to teach and hold a clinical position at Columbia Presbyterian Hospital and the College of Physicians and Surgeons. In 1931, she was hired by New York City's Division of Laboratories and Research, where she was made the director of its bacterial laboratory. By 1944, Hazen was in charge of an investigation into fungi. Hazen entered an intense study of mycology at the College of Physicians and Surgeons in order to begin a systematic collection of disease-causing fungi using soil sampling techniques. By 1948, she had identified some new antifungal agents, including a filamentous bacteria named actinomycetes, and I probably butchered that name. Now she needed a chemist to help her isolate the antifungal substances. Her division chief, Gilbert Daldorf, introduced Hazen to Rachel Fuller Brown, who was over in Albany, also working for the state. With Hazen in New York City and Brown in Albany, the U.S. Post Office became the third party in this research project. In her New York City lab, Hazen cultured soil samples sent to her via mail from around the world against two fungi, Candida albicans and Cryptococcus neoformis. She put the cultures in mason jars and then mailed those to Brown in Albany. Brown would then work her magic with solvent extraction processes to isolate the active ingredients, which she would then put back in the mail to Hazen in New York City. It would then be evaluated by Hazen for toxicity on animals. Of all the soil samples they tested, the one culture that fit all criteria for their work was from soil that Hazen had collected in her friends, the Norses's garden in New York. That culture was Streptomyces norsei, named after them. This sample contained a substance that Hazen and Brown named fungicidin. However, they discovered that name was already in use, so they renamed it Nystatin for New York State. Dahldorf encouraged Brown and Hazen to publicly announce their discovery at a regional meeting of the National Academy of Sciences. Dahldorf then went to the Research Corporation, who did legal services for universities and public sector scientists at that time, to help them secure a grant. It took several years, but eventually E.R. Squibb bought the patent rights, conducted the clinical trials, and continued on and did all the things that it takes to put medication into production. Once in production, the royalties from all sales of Nystatin were placed in the Brown-Hazen Research Fund, a fund that was created and eventually would produce over $13.5 million in grants for future life science researchers, especially women. Mycostatin and Nystatin is still the most effective and inexpensive treatment for fungal infections. Brown and Hazen would go on to discover two more antibiotics, phalmycin and capsaicin. In 1975, they were the first women to receive the Chemical Pioneer Award from the American Institute of Chemists. Hazen was awarded the Squibb Award in chemotherapy and accepted into the National Inventors Hall of Fame posthumously, along with Brown, in 1994. Hazen died in a nursing facility in Seattle, Washington in 1975. She was 89 years old. While she is not well remembered in the MUW or the state of Mississippi's history, she is clearly an alum and a former Mississippian who made a significant contribution to the fields of medicine and mycology. I want to thank you for coming to my podcast. Until next time.